This is one of the more important changes, because in the past, there were no non-discrimination rules for health plans other than under HIPAA for health conditions or age, race, and sex. So in the past, an employer could provide a different health plan to their executives or to their owners than the rank and file. And that was one of the benefits of having an insured plan. Also on slide 14 is employers will have increased reporting. As it says, by March 23, 2012, HHS will develop requirements for plans to report a variety of issues. So they will go in and monitor how your plan is doing. So this reporting will include information regarding improving health outcomes, activities to prevent hospital readmissions, activities to improve patient safety and wellness, and health promotion. It's either going to be you or your insurer will have to do these reports. Now, one of the more controversial new requirements is covered on slide 15. And what slide 15 indicates is the fact that this will hit the insurance companies starting in January 2011. And what this slide is trying to say is that insurers, when you're determining a premium and you're offering a product for employers with under 100 participants, what you have to do, your premium and your loss ratio, in other words, what you're paying out in benefits, must be at least 80% of the premium. And for employers with over 100, it must be 85% of the premium. So if your premium is $1,000, $850 of that must go to pay claims. Well, currently, my friends in the insurance industry tell me that insurance companies can't meet this. They're at 65 to 70%. And the only plans that can meet this requirement are in large, self-insured employer plans. Insurance companies cannot do this. So it's going to be very interesting to see what the pushback is, and this is effective starting January 1st, 2011. Now, other requirements that are effective for plan years beginning after September 23rd, 2010 are, first of all, appeals process. You have to have your insurance company or your employer's plan must have a much more sophisticated appeals process. Plans will be required to have external review process. You must give detailed explanations to your employees, and plans must allow participants to review his or her file, present evidence, and testimony, much more sophisticated than it is now. If you have an insured product, the insurance company must make sure they meet this requirement, but it applies both to insured and self-insured programs. Also, plans in the future, both insured and self-insured, cannot pick a provider for you.
This is Philip. I just want to, we had a couple of questions asking if we could slow down a little bit. I just want to let the audience know that this is being recorded, so if there's information, we'll have this archived and they'll have an opportunity to go and listen to it in the future as well.
Oh, thank you.
All right, go ahead.
So in the future, both insured and self-insured plans cannot pick a provider for you. You must allow a participant to pick their own provider in the network, but they can't do it for you. That's slide 17. Slide 18 says, for plan years beginning after September 23rd, in regard to emergency services, plans must indicate, first of all, that you don't need prior approval or authorization to provide emergency services, and it must provide services from out-of-network and plus in-network providers. So again, for the first time, the federal government's coming in and indicating to you the mandated benefits inside your insured product for the first time. And these changes are effective beginning for plan years after September 23rd, 2010. Slide 19, pediatric services. What this slide is trying to say is that for your participants, inside of insured or self-insured plans. You must allow a participant to choose a physician who designates themselves as a specialist in this area. You must give that employee that choice. Also in slide 20, for those specialists that you see here, and this is going to affect HMOs and other plans where you need referrals. What this slide is trying to say, starting September 23rd for planners beginning after that date, to go and to see those specialists on slide 20, no longer can a plan require a pre-authorization or a referral to see these specialists. So that's going to affect HMOs specifically. You must have direct access to those individuals. Now, slide 21 is extremely important because what it indicates is the government and states are going to monitor insurers' profits, or premiums, excuse me. But it doesn't indicate they're going to limit their profits. They're just going to watch them and report. So there may be further action in the future. But there's nothing in, if the insurance company can justify the increases, there's nothing that limits the increases that the insurance companies can charge. Now, another change that's effective as of March 23rd, 2010, there's no more dumping of participants by insurance companies. And what HHS is going to do is provide a temporary high-risk insurance pool that individuals that are dropped can get insurance, and they will cooperate with the states to provide coverage. But this will be a temporary solution. Because remember, starting in 2014, and I will cover this in a second, there's no more pre-existing conditions. But until then, there's going to be an alternative. Now, one of the most important new changes is covered on slide 23. This program will be up and running as of June 21st, 2010. And what HHS is going to do is provide and establish a temporary reinsurance program to reimburse employer plans for a portion of the cost of providing health coverage to early retirees, those between 55 to 64. And what the program's going to do is going to be reimbursing 80% of the cost between $15,000 to $90,000 of the covered individual. This program will be up and running June 21st, but the program is going to be capped at $5 billion. So I'd be interested to see how long this program lasts. Is it going to be longer than 20 or 30 minutes? So many of those changes are effective for plan years beginning after September 23rd, 2010. These next changes that I'll be talking about apply to insured and self-insured plans. And those changes are not until 2014 unless otherwise specified. And the first important change is covered on slide 24 as pre-existing conditions. Starting in 2014, any pre-existing condition exclusions are done. So this will affect primarily the individual market, that individuals will now be able to jump on plans and the insurance companies cannot prohibit them from doing so. But look at this slide, because one thing is very important before that date is that any participants or dependents that are under age 19, there's no more pre-existing conditions for them. And this is for plan years, the first plan year beginning on or after September 23rd, 2010. So generally, it's going to go away in 2014. But for any participants or dependents under age 19, it's applicable for any plan years beginning after September 23rd.